Factsverse presents 16 Terrifying Rare Birth Diseases. Number 16. Progeria, which is an extremely rare genetic disorder that resembles aspects of aging at a very young age. Those born with this disease typically live to their teens or early 20s. It is more commonly a mutation than a genetic disorder. There has been no treatment that has been proven effective, although children may benefit from a high-energy diet. Number 15. Fibrodysplasia ossificans progressiva causes tendons and ligaments to be replaced by bones. It causes formation of extraskeletal or heterotopic bones that constrains movements. There have been cases where surgical removal of extra bone growth has been shown to cause the body to repair the affected area. Number 14. Foetus in foetu, or fetus in fetus. It's a developmental abnormality that causes a mass of tissue resembling a fetus that forms inside the body. It affects 1 in every 500,000 live births. It is in most cases a twin inside a twin. The twin inside does not survive, but the developed twin can in most cases. Number 13. Sometimes babies are born with fused limbs. This is also known as mermaid syndrome when it occurs in the legs. It is a fatal condition where the legs fuse together in the womb. It affects 1 in every 70,000 births. It is fatal before or immediately after birth because there is malformation, incomplete development, or absence of vital organs in the infant's body. Babies born with this condition usually die a few days after birth. Number 12. Ambrus syndrome is an extremely rare skin disease. It causes excessive hair growth on the entire body except for on the soles, palms, and mucous membranes. Someone with Ambrus syndrome may also have dental and face abnormalities. Number 11. A more commonly heard of but still extremely rare birth disorder is Siamese twins. It affects less than 1,000 births per year. This means that 2 babies are born physically connected to each other. It cannot be cured, but there are some treatments that may help. Number 10. Cyclopia affects 1 in 16,000. With this defect, there was a failure to properly divide the orbits of the eyes into 2 cavities. This means that the baby is born with only 1 eye. The eye has a placement of the location that usually holds the nose. This also means there is a missing nose. There is an extremely low survival rate for this condition. Number 9. Ectopia cordis means that the heart is abnormally located partially or completely outside of the thorax. In most cases, the heart protrudes outside the chest through a split. Limited treatments are available for this disease because of its rarity. Successful surgeries have been performed, but this disorder does have a high fatality rate. Number 8. Babies born with congenital arrhythmia are born without a nose. This affects 1 in every 197 million births. They are also born without a nasal cavity or olfactory system. As babies get older, there is a possibility for constructive surgery. Number 7. Epidermolysis bullosa is a birth disorder that causes the skin to blister. This is usually something that is inherited. Blisters can be caused for a number of different reasons: minor injury, adhesive tape, heat, rubbing, and scratching. More severe cases form inside the body. This could be on the lining of the mouth or the intestines. There is no cure, but for mild cases it may improve with age. Treatment focuses on preventing pain, itching, and infections. Number 6. Harlequin-type ichthyosis is a very severe skin disease that is genetic. It causes thickening of the skin. At birth, the baby's entire skin is covered with thick, white plates of skin which are separated by cracks. Eyes, ear, penis, and appendages may be abnormally contracted because of this. This causes cracks in skin where the skin would normally fold. Because of this, it is highly susceptible to bacteria and contaminants, which can result in fatal infections. This disorder requires constant care in order to keep the skin moisturized and protect the skin. The baby may also be put on medication that will need to be taken throughout their lifetime to control the disease. Number 5. Lamellar ichthyosis is a disorder that lasts through an entire lifetime. A newborn baby will be born in a collodion membrane that will shed 10 to 14 days after birth. After the membrane sheds, redness of a skin of generalized scaling will be revealed. This disorder is not life-threatening, but can often be disfiguring. There is no cure for this, so basic treatment is decreasing the symptoms of the disease. It usually involves the application of emollients on the skin. Number 4. Polymelia is a birth defect causing a baby to be born with an extra limb. This limb is usually shrunken or deformed. With polymelia, the embryo usually starts as twins, but one remains underdeveloped, leaving extra limbs on the twin that survives. It only affects 1 in a million births and usually can be cured by a surgery. Number 3. A rare but treatable disease that affects less than 200,000 per year is hydrocephalus. This disease is characterized by head enlargement in infants. It is a buildup of fluid deep within the brain cavity. It also can affect both children and adults alike. Treatment involves inserting a tube surgically into a ventricle to drain excess fluid. Number 2. Craniopagus parasiticus is one of the more extremely rare newborn diseases. It affects 4 to 6 out of every 10 million babies. With this disease, there were actually twins and one did not survive. The one that survived ends up with a parasitic twin head attached to its head. This is another condition with a very low survival rate, and the babies are usually born as stillborn or die a short time later. Number 1. Anencephaly is a rare condition that affects less than 20,000 babies per year. Anencephaly causes a baby to be born with an incomplete skull and underdeveloped brain. A baby born with this disease is not expected to survive. They may either be born a stillborn or only live for a few hours after birth. Unfortunately, there is no cure for this disease, with the main symptom being unconsciousness. In the short hours of the baby's life, the primary treatment is making the baby as comfortable as possible. Subscribe for more.